Good morning, Dr. Rakel. I would like to ask you a few questions about your integrative medicine work, how it is work, what is the relationship between conventional medicine and other traditional medicine, and anything you want to talk to us in your own words, please.
Thanks, Fernando. You asked how we define integrative medicine, and I think it's a term in evolution of what hopefully a lot of medicine is going towards, as well as returning to its roots. And that's, to put it simply, understanding how complex systems heal. And the term integrative medicine came from the importance of combining both traditional as well as non-traditional methods. So we like the word integrate to really integrate what works best for the unique individual, the unique community, to help develop a science that really understands how a complex system can find its own balance towards resiliency and sustainability and optimal health.
This goes very much on the way that my friend Kingsley Dennis talks about the struggle for your mind, conscious evolution, and the battle of. So I think that we've been talking about the spirituality a lot since many years ago. It's been published in British Medical Journal, Annals of Internal Medicine, and everywhere. But I think still there is not as present as it should be, or there is some opposition. What are your thoughts about that?
Yeah. Personally, in regards to understanding how complex systems heal, I think it's one of the most powerful healing influences we have is to understand someone's spiritual connection. And I've also learned to be careful, particularly in this academic world, to be careful with the words I use. So I may not call it spirituality, I might call it a connection that gives your life meaning and purpose. And if you talk that way, it's a conversation that every human being can have, versus the analogy I like to use is the flower. The poem of the flower is something we can all find a poem that we resonate with most, versus a specific religion. Some of us resonate with one religion, but not everybody. Yeah. And so how can we create a poem that I can understand which poem you like to best define the flower? Right. That way I can use that poem to help you heal. And that's the strategy that I found successful in teaching medical students and residents how to incorporate this into people's lives as one of the most important ingredients in understanding how systems heal. And it's a challenge. In order to do that, we first have to define our own spirituality, our own connection that gives life meaning and purpose. So we're first of all aware of our own belief system, and then once we're aware of that, we can be careful not to inappropriately project that onto others when they may not believe like we do. So I can really transcend my perception to the patient's lenses and start to see life through their lenses so I can help their spirituality grow.
That means that we have to be very careful about the use of words, and we should try and keep very self-aware of ourselves, to know ourselves better. I think this is a thing which has been loosened through the years, because there is so much technical thing going on. There is so much huge inventions and huge, very, very brilliant, sort of intelligent ways that we have forgotten things which always work. And I remember seeing my father working. He was a doctor, general doctor, and I felt resonant with him in the way he did that. So I continue all my career, remember him. And perhaps we could have some other people we sort of anchor to them, or those thoughts that will help us. Could you say anything about that?
My father was a general physician as well, and so I resonate with that. And that's part of what I hope to do, is say, okay, I listened to your story. We both come from a similar background. That old saying of when the person's ready to heal, the healer will present himself. That how can we really match that person who's best able to help them through, just like if I was going to match a spiritual guide to a rabbi or a priest or a best friend or a physician, whoever that might be, how can we do that? I think we get in trouble in traditional medicine because our science becomes our religion. And we run in the same trap as people who go into holy wars, saying that if you don't believe like I do, we're going to go to war and we're not going to be nice to each other. So I think in science, our religion or our belief system is the reductionistic science, which is beautiful, right? It can really help us explore the beauty. But if that's the only world we live in, we miss this larger picture of this mystery and awe that really resonates.
All of us, we have that, haven't we? Because sometimes when I talk with my friends, they tend to think, well, this is important what you're talking about, our imaginary, or the ways we understand love, or other words, not big L love, but normal love. And some people say, well, that is okay, but that's not part of medicine. What do you think about that?
Well, I might go out on a limb here, but I think it's all of medicine.
Yeah, that's what I think.
I think we have a tremendous opportunity to do the science and to continue to do this exciting research and understand how this mystery works within the context of love. And if we can do that within the context of this spiritual meaning and purpose in our lives, it makes that science become all the more beautiful and exciting. And I believe strongly, and I think this is true, if you interview some of the most wonderful researchers in our field, is they get that. They get that this thing that they're researching is within a larger complexity of beauty. And then they're able to understand that particle much better.
How do you think that we could sort of, or anyone could sort of spread this way of thinking between students, residents, avoiding that sort of diminishing in empathy that you were putting the other day in your class? Yeah. When the students arrive and then when they leave, they have less empathy. I presume because of role models they've seen, because they became overwhelmed by technical things, perhaps. So what do you think we could do to spread this sort of thing, or to increase or to keep at least empathy at the same level that we started?
It's not an easy task, but I think we need to live it. You know, we need to show by example how important this is. And I think part of the reason empathy goes down through the years of medical school is that we honor the cerebellum, the thinking mind. We don't really honor the limbic system or the emotional mind. But if you see what's successful in a physician after they graduate, it's the combination of the cerebellum and the limbic system to really be an emotionally intelligent physician who's able to use that science in a strategic, creative way that best matches the needs of the unique individual. And so I'm excited because people like you are spreading this word of the importance of this. And they can live together, but people get threatened because it's a different belief system that they're used to. So gradually we can change that.
Yeah, I remember now an article, I think it was Schumann, talking about the connectional experience of the moments when you are treating a patient that you get connection. Sometimes when you connect, it opens new rooms for you, and sometimes we are afraid of that because it means that we should sort of inspect the room and see what is there, which is self-awareness, as we were talking before. Is that correct?
Yeah. I couldn't agree with you more. Sometimes if you have that awareness in the room and you're actually present with your patient, some beauty happens that you can't explain that makes both your hairs stand on edge, and you know some sort of shift happened there. When you allow that to unfold in the clinician encounter, it makes it all worthwhile because you know something happened there. You can't really define it, but there was a shift in awareness that really is powerful.
In fact, what I feel is in a clinic, the times where I have been feeling that, at the end I felt perhaps physically tired, but certainly very, very, very strong in myself. I don't know the words in English, but very centered and very happy in one way. So this is more or less what I wanted. If you could tell us, because I'm going to put that in this World Shift International, if you could say anything to the friends who are going to read it as a resume, as a summary of what we've been talking about.
Well, Fernando, you and I have been talking about you know, it is somewhat mysterious, and of this spiritual connection in the work that we do that we need to start talking more about, I believe, so we can really provide better care. Because if we just provide one or the other, we're going to be somewhat lost. We need the science and the spiritual connection. We need the spiritual connection and the science. And one without the other is somewhat lost. And so I think our job is to really find that middle ground that really honors what is real and authentic in our patients' lives. And if you don't talk about this, you're not touching on authenticity. And so it's fun to have the opportunity to talk to you about that today.
Thank you very much, and good luck with this work.
Thank you.